Hi everyone, in this episode of the Need to Know Show, I'm going to share with you 6 of my favorite exercises to perform with a Swiss ball or a physio ball. Hi everyone, so today we're looking at exercises to do with a very common, very popular piece of exercise equipment, the Swiss ball. So let's go through these. They're all good exercises for either your prehab, your preparation before surgery to build strength, to build mobility, to build functional mobility as well. And of course, they're also very good exercises for after surgery as your physical therapy and recovery after surgery as well. So one of my favorite ones is wall squats using the physio ball. So to do this, you're going to put the physio ball up against the wall, and then you're actually going to put your back to the ball. And I like to put my feet out pretty far actually, and I'll explain this in a second. And you want about shoulder width apart, maybe a little bit more, and the toes can be forward, or if a little more comfortable, a little bit pointed out is okay as well. And then all you're going to do is keeping your head up, keeping your eyes forward, you're going to squat down, try to get to parallel, try to get to that 90 degrees, and then squat back up. And of course you can do repetitions, you can do 8 to 12 reps. If you're really up for it, you can do holds, so wall sits. Your hands really can be wherever. You can put them on your thighs, you can hold them in front of you. You can do this if that gives you a little more stability. And the great thing with wall squats with the ball is, one, it makes you a little bit more stable, a little more comfortable, especially after surgery or if you have a lot of knee pain. Doing this motion can be very uncomfortable initially. So giving that little stability, holding on with your back, can help just make you a little more comfortable doing this motion. Also, being able to put your legs out, so you're kind of leaning back against the wall and putting your legs out, means that your knees aren't tracking as far forward. So as you come down, your knees don't bend up toward your toes or past your toes very far. They're actually back a little bit more, you might notice. And this is very good because what it's going to do, it's going to stress your glutes, your hip muscles, a little more than your knees. So if you have a significant amount of knee pain and discomfort, you can put your legs out nice and far, and that's going to put a little bit less stress through your quadriceps, through the knee joint, and make this movement a little more tolerable. As you get more comfortable, get a little bit stronger, you can kind of progress, bring your feet in a little bit more, and then you'll notice the knees are going to come out a little bit more. It's going to be a little bit more work for those quadricep muscles of your thigh, and maybe just a little bit more stress on those knees as well. So that's wall squats. The next one of my favorites, is hamstring curls. So this one you're actually going to do laying on your back. Hopefully you can, of course, do this on a therapy table, or if you don't have something, hopefully you can find somewhere you can do this at home. Obviously getting on and off the ground might be a little bit challenging, especially initially, either before surgery or initially after surgery. But with this exercise, you're going to bring your feet and you're going to put them up on top of the ball, and then you're going to lay back. And the easiest one to do is just curling the legs in and out. So you're going to curl in and out, in and out. Once you get comfortable with that one, what you're going to incorporate is you're going to do a bridge. So you're going to bridge up, lifting your hips and your bottom, and then you're going to do that curling in and out while holding that upward position. You'll definitely start to feel this in your hamstrings and those muscles in the back of your thighs. Gives you a really good workout, really good burn. My suggestion is start easy, maybe do 1 or 2 sets, and kind of progress up from there, especially if you haven't done this exercise before, because you will really feel your hamstrings start to work and start to tighten up a little bit potentially. Another one is a good one for working your hip muscles, working your gluteus medius, gluteus minimus, is an isometric exercise. So an exercise where you're actually holding the position. So putting the exercise ball or the physio ball between you and the wall, and then you're actually going to have the ball on your side like this, and then you're going to lift up the leg closer to the wall, the leg touching the ball, and you're just going to provide a very gentle push into the ball with your whole leg. So I tell people it's like you want to do this motion with your leg, but the physio ball is there in the way. So you're here standing on one leg and you're pushing this leg into the ball. And what you can do is you push and you hold it. So you hold for maybe 10 seconds, do a couple repetitions, a couple sets, working up to maybe holding it for 30 seconds, 45 seconds, even up to a minute if you have that good strength and endurance. And you'll notice that you're going to feel that just as much in the hip that's by the ball, and you're going to feel it on the opposite hip and glute, the one that you're standing on as well. And it's really good to do both sides with this exercise. Again, shooting for about 30 seconds, 45 seconds, and a couple of sets. Another exercise, one I kind of showed you before, was the plank, or was the bridging. So as part of the hamstring curls, and then bridging in and out. You can also make this just a general progression of the bridging exercise. So lifting the hips up and down. If you want to make it a little more challenging, bend your legs and try from here. You'll feel that in the hamstrings working hard. So a good strengthening exercise for the hips that starts to introduce a little bit in stability, has to make you stabilize a little bit more, contract those abdominal muscles a little bit more. The next one to show you is going to be planks. So this is of course a good exercise for your abdominal muscles and your trunk muscles. The easier version, I don't like to say easy because this is still challenging, is to do a plank with your forearms on the ball, trying to hold that good position. See how long you can do it, maybe 30 seconds, 1 minute. And then a little bit more challenging, not that that one wasn't challenging, but you can also try with your feet on the ball. And you can hold it kind of in this push-up position, or you can even do kind of on that forearm position as well. I like to do the push-up position just because your feet are already elevated. So let me get set here. So doing it this, obviously a little bit more challenging, but a really good one for working your core and trunk muscles. And then the last one I'd like to show you today is just sitting on the ball. You know, there's some studies out there that people who, you know, they work desk jobs and they sit on that exercise ball throughout the day, and it actually helps burn a couple calories, works those muscles just a tiny bit. But also you can start to incorporate some movements that make it a little more challenging. So doing some knee extensions up and down. You can do marches up and down, trying to keep the good posture, don't slouch. You can do things with your arms, whatever it may be, just sitting on that ball, stabilizing yourself, stabilizing your hips and pelvis, and then introducing some motions where you have to have a little bit more strength, a little more stability, and again, activating some of those muscles of your trunk and core to work hard as well. So those are some of my favorite exercises to do using the Swiss ball or the physio ball. I'd love to hear if you have any that you like to do in addition to the ones I showed you. Any questions, of course, are welcome. And as always, be sure to hit that button in the lower corner to subscribe if you're catching this on YouTube. I post videos every day, everything related to knee pain, managing knee pain, exercises, physical therapy, knee replacement surgery, you name it. Thank you very much for watching, everyone. Have a great day.